Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-year cancer survivor, available on Amazon. When you tell someone that you are dealing with cancer, oftentimes the person on the receiving end of that news may feel uncomfortable, may feel unsure of how to respond, what to say. And oftentimes, what comes out of them will be what we consider dumb things to say to a cancer patient. That's not their fault. They're not used to dealing with cancer or whatever. And we try to assure them that really telling us about an aunt who's passed or somebody who's had a cancer that was even worse or whatever, that does nothing to help the cancer patient. But when it comes to definitely the stupidest thing to say to a cancer patient comes from the most unlikely of resources. It's not even a close call. You would think giving somebody the cancer news that they were going to be unalive, dealing with something that could result in them being alive, would be the worst thing for a doctor to say to a cancer patient. I mean, yeah, it's a bad thing, but there is something that is said and has been seemingly said forever, much to multiple objections. Doctors continue to say it. Back in 1988, I was being diagnosed with Hodgkin's lymphoma. And before my oncologist had even shook my hand, he said this to me. Quote, Hodgkin's lymphoma is one of the most treatable forms of cancer with a high remission rate. Now, that all sounds good, but here came the punchline. If you were going to get a cancer, this is the one you want to get. End quote. What did he just say to me? The cancer I want to get? How about no? Or how does that go? How about no? Okay, I didn't want any cancer ever. And I get it that there are many treatable cancers and they do okay with success. And there are other cancers that are not. And then there are the cancers with the higher remission rates, testicular, thyroid, melanoma. When these are all caught early, prostate, even certain breast cancers, and of course Hodgkin's lymphoma. They all have high remission rates. Now, at no time had I ever gone through my life and thought to myself, well, I know I'm going to have cancer someday. I sure hope it's this one. Or how about, prayer? Now I lay me down to sleep. I pray the Lord my soul to keep. If I should get cancer, please let it be this one. Seriously, I never wanted cancer. I never wanted to have to deal with all these late side effects from my treatments that are well documented on this page, as if it were some sort of trade-off for my longevity of being treated for the cancer I would want. No one will ever appreciate a doctor wanting to be encouraging as much as I do. Okay? But telling a patient they got the best cancer to have is not it. Telling a cancer patient that they have a butterfly cancer or a deer cancer doesn't make it any better just because you attach a cute description to it. As soon as we hear the word cancer, we automatically think being unalive. Now, I know the doctors mean well. A doctor would never say anything to be intentionally upsetting. But it would be assuring enough to us. If you just tell us how confident you are that with the current modes of treatments, you believe you have great odds, quote all the stats that you want of getting us into long-term remission. Can you see how inspiring that is? If you want, you can even add one of the more successfully treated cancers, and especially based on type and staging. There's no reason at all that saying this is a cancer you want to get if you're going to get is beneficial or inspirational at all. I can't believe after 40 years, and I know cancer patients are still bringing up this comment that still gets said to them, that it's still being said today. I know I have many doctors that follow my page, including oncologists. And I hope that you hear these words and understand that that phrase, that comment, the cancer you want to get is more harmful than good. Just stick to the stats, stick to your skills, stick to your knowledge, and tell us that you have every reason to think you're going to get us through this. And that'll be good enough. Until next time, this is Paul's Heart.